Hey everyone, and welcome to today's lecture. We are diving into a very important medication, levothyroxine, commonly known by its brand name Synthroid. This medication is a cornerstone in treating hypothyroidism, a condition affecting millions worldwide. In this video, we will cover several key aspects of levothyroxine. By the end of this video, you will have a solid understanding of levothyroxine and its role in managing thyroid health. So, let's start with the basics. The thyroid gland itself. As you can see, it's located in the front of the neck, just below the larynx. It has a distinct butterfly-like shape with two lobes connected by a narrow section called the isthmus. The thyroid is an endocrine gland, meaning it secretes hormones directly into the bloodstream. Its primary function is to produce thyroid hormones, which are vital for regulating many bodily functions. The thyroid gland produces two main hormones, thyroxine or T4 and triiodothyronine or T3. T4 is the major hormone produced by the thyroid and contains 4 iodine atoms. However, T3 is the more biologically active form. Most of the T3 in our bodies is actually converted from T4 in other tissues, and it contains 3 iodine atoms. The production of thyroid hormones is a carefully regulated process. The hypothalamus in the brain releases thyrotrophin releasing hormone or TRH. TRH then stimulates the pituitary gland also in the brain to release the thyroid stimulating hormone or TSH. TSH in turn acts on the thyroid gland, prompting it to produce T4 and T3. This system operates on a negative feedback loop. When T4 and T3 levels in the blood are high enough, they inhibit the release of TRH and TSH, preventing the thyroid from producing too much hormones. Thyroid hormones have a wide range of effects throughout the body. They are crucial for regulating our metabolism, influencing how our bodies use energy from food. They increase our basal metabolic rate, affecting the metabolism of carbohydrates, proteins, and fats, as well as our oxygen consumption and heat production. Thyroid hormones are also essential for normal growth and development, particularly brain development in fetuses and also in infants. And they promote bone growth and also their maturation. They also affect the cardiovascular system, increasing the heart rate and the force of heart contraction, and also influencing the blood pressure and also blood flow. Furthermore, they play a role in nervous system function, affecting mood, alertness, and reflexes. Finally, they help regulate body temperature and influence the health of our skin, hair, and nails. Now let's discuss what happens when thyroid gland does not produce enough of these crucial hormones. This condition is called hypothyroidism. Hypothyroidism is a condition where the thyroid gland is underactive and does not produce sufficient amounts of T4 and T3. There are several causes of this condition. In many parts of the world, the most common cause is Hashimoto's thyroiditis, an autoimmune disease where body's immune system mistakenly attacks the thyroid gland. Iodine deficiency is another significant cause worldwide, although it's less common in developed countries where salt is often iodized. Other causes include surgical removal of the thyroid gland called thyroidectomy, radioactive iodine treatment often used for hyperthyroidism or thyroid cancer, Certain medications like lithium and amiodarone, congenital hypothyroidism, being born with an underactive thyroid, that is congenital hypothyroidism, and problems with the pituitary gland, secondary hypothyroidism, or the hypothalamus, tertiary hypothyroidism, which regulate thyroid hormone production. The symptoms of hypothyroidism can vary but often include fatigue, weakness, weight gain, feeling cold even when others don't, constipation, dry skin, hair, and a slow heart rate, which is known as bradycardia. Also, depression, cognitive impairment such as memory problems and difficulty in concentrating, muscle aches, stiffness, and sometimes an enlarged thyroid gland known as goiter. This is where levothyroxine comes in. Okay, so levothyroxine, often prescribed as Synthroid, is a synthetic form of the T4 hormone, chemically identical to the thyroxine that our own thyroid gland produces. When taken orally, levothyroxine is absorbed in the small intestine. Once in the bloodstream, it travels to various tissues, including the liver and kidneys, where it converted into the active T3 form. T3 then enters the cells and binds to the receptor in the cells or the cells of the nucleus. This binding triggers the transcription of specific genes and increases the synthesis of proteins that are essential for various physiological processes. In essence, levothyroxine replaces the deficient thyroid hormone, helping to restore normal bodily functions. Levothyroxine is primarily used to treat hypothyroidism, regardless of the cause. It's also used to suppress TSH levels in the patients with thyroid cancer, which can help prevent cancer growth. In its intravenous form, it can be used to treat myxedema coma, a life threatening condition of severe hypothyroidism. Now, let's talk about how to take levothyroxine properly and some important considerations. The dosage of levothyroxine is highly individualized. Your doctor will determine the appropriate dose based on several factors, including your TSH and free T4 levels, your clinical symptoms, your age, and your cardiovascular status. For optimal absorption, levothyroxine should be taken on an empty stomach, typically 30 to 60 minutes before the breakfast. Consistent timing each day is crucial to ensure your body absorbs the medication effectively. It's important to be aware of potential drug interactions. Certain substances can decrease the absorption of levothyroxine. These include some foods such as soy products, walnuts, and high fiber foods, as well as medications like calcium carbonate, iron supplements, antacids containing aluminium or magnesium salt, sucralfate, cholestyramine, etc. Other medications such as rifampin, phenytoin, carbamazepine can increase the metabolism of levothyroxine, potentially requiring a higher dose. Now, important considerations like regular monitoring of thyroid hormone levels through blood tests, specifically TSH and free T4 is essential. This allows your doctor to adjust the dosage as needed to ensure you are receiving the correct amount of medication. Certain populations require special considerations, like pregnant women often need increased levothyroxine doses and their thyroid levels need to be monitored closely. Elderly patients and those with cardiovascular disease typically start with a lower dose, and the dosage is increased gradually to minimize the risk of side effects. Levothyroxine is generally well tolerated when taken at appropriate dose, However, taking too much can lead to symptoms of hyperthyroidism or over replacement. These symptoms can include a fast heart rate called tachycardia, nervousness, anxiety, tremors, insomnia, weight loss, heart intolerance, and also chest pain. It's important to report any of these symptoms to your doctor. In conclusion, levothyroxine is a safe and effective treatment for hypothyroidism when used correctly. It's crucial to follow your doctor's instruction carefully, adhere to the prescribed regimen, and attend regular follow-up appointments for monitoring. By doing so, you can effectively manage your symptoms and improve your long-term health outcomes. Now let's address some frequently asked questions about levothyroxine. Is it okay to stop taking levothyroxine once my symptoms improve? No, it's generally not okay to stop medications or levothyroxine on your own, even if your symptoms have improved. In most cases of primary hypothyroidism, the condition is chronic, meaning it's long lasting. Stopping the medication can lead to a return of hypothyroid symptoms. Always consult your doctor before making any changes to your medication regimen. They will monitor your thyroid hormone levels and determine if any adjustment are necessary. How long does it take for levothyroxine to start working? The time it takes for levothyroxine to start working can vary from person to person. Some people may start to notice an improvement in their symptoms within a few weeks of starting the medication, while for others it may take longer time, sometimes several weeks or a few months, to reach the optimal thyroid hormone levels and experience significant symptomatic relief. So it's important to be patient and continue taking the medication as prescribed, even if you don't feel better right away. Your doctor will monitor your progress and adjust your dosage as needed. What happens if I take too much levothyroxine? Taking too much levothyroxine can lead to symptoms of hyperthyroidism, which is the opposite of hypothyroidism. These symptoms can include a rapid heartbeat, nervousness, anxiety, tremor, insomnia, weight loss, heat intolerance, chest pain, like this. In severe cases, it can lead to more serious complications. If you suspect you have taken too much levothyroxine, contact your doctor or seek medical attention immediately. Can levothyroxine cause weight gain? Levothyroxine itself does not typically cause weight gain. In fact, one of the symptoms of untreated hypothyroidism is weight gain. Okay, when levothyroxine is taken correctly and thyroid hormone levels are normalized, many people find that they lose some of the weight they gained due to the hypothyroidism. However, weight changes can be influenced by many factors, including diet, exercise, and other medical conditions. If you are concerned about weight gain, it's best to discuss it with your doctor. Are there any natural alternatives to levothyroxine? There are no natural alternatives that can completely replace levothyroxine in treating primary hypothyroidism. Levothyroxine is a synthetic hormone that replaces the hormone your thyroid gland is not producing. While some dietary changes and supplements may support thyroid health, they cannot take the place of hormone replacement therapy. Some people explore natural desiccated thyroid, but this is also a medication and its use should be discussed with a physician. It's crucial to work with your doctor to determine the best course of treatment for your specific condition. So, thank you for joining me today. I hope this lecture has provided you with a better understanding of levothyroxine and its role in the treating hypothyroidism. Remember, this information is for educational purpose only and should not replace professional medical advice. Always consult with your doctor for any health concerns or before making any decisions related to your medication or treatment plan. Thank you.